Today we will discuss acute cholecystitis, but really quickly, are you fed up with lectures using complex vocabulary to appear smarter? Whether you're a current student or healthcare provider, doctor, nurse, or pharmacist seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Acute cholecystitis is a sudden inflammation of the gallbladder, a small organ that helps with digestion. It's often caused by gallstones blocking the bile duct, leading to pain and other symptoms. Signs you might have acute cholecystitis: severe pain, pain in the upper right abdomen, which may spread to the shoulder or back. Nausea and vomiting, feeling sick to your stomach and possibly throwing up. Fever, a high temperature which indicates infection. Bloating, your abdomen may feel swollen or full. Jaundice, yellowing of the skin or eyes indicating a problem with bile flow. When to see a doctor: if you experience severe abdominal pain, especially after eating fatty foods, or if you have any of the symptoms mentioned above, it's important to seek medical attention immediately. Acute cholecystitis can lead to serious complications if not treated properly and promptly. If someone has acute cholecystitis, here's what to do. Seek medical help. Go to a doctor or to the hospital right away. This is important for proper diagnosis and treatment. Don't eat or drink. Avoid food and drinks until a doctor evaluates your situation. This helps prevent complications. Pain relief. If allowed by a doctor, over-the-counter pain relievers may help ease the pain. Follow doctor's advice. Treatment may include medications or surgery to remove the gallbladder, so follow what the doctor recommends. Encourage the person to rest and avoid physical activity until they feel better. Always prioritize getting professional medical help. In the hospital, here's what they typically do for someone with acute cholecystitis. They check symptoms. Doctors will ask about symptoms and do tests like a blood test and imaging like an ultrasound to confirm the diagnosis. IV fluids. They will give fluids through an IV to keep the person hydrated since they might not be eating or drinking. Pain management. They will provide medication to help relieve pain. Antibiotics. If there is an infection, they will give antibiotics to help treat it. Surgery. Often the gallbladder needs to be removed. This is usually done through a procedure called laparoscopic cholecystectomy, which is less invasive. Recovery care. After surgery, they will monitor the person, manage pain, and help them start eating again when ready. The goal is to relieve pain, treat any infection, and prevent complications. Here are some commonly used medications for acute cholecystitis. Number 1, we have pain relievers such as acetaminophen, brand name Tylenol. This helps reduce pain and fever. Ibuprofen, brand name Advil or Motrin, an anti-inflammatory drug that also relieves pain. Antibiotics, those are used to treat infection. We have ciprofloxacin, which is often used for bacterial infections, and this falls under the class of cephalosporins. Metronidazole, brand name Flagyl. This is effective against certain bacteria and used in combination with other antibiotics. Piperacillin tazobactam, brand name Zosyn. This is a broad-spectrum antibiotic for severe infections. Nausea medications such as ondansetron, brand name Zofran, helps control nausea and vomiting. Zofran is also a very common medication for people with cancer for the same purpose of controlling their nausea and vomiting from their chemo. Doctors will choose specific medications based on the patient's condition and health history. Always follow medical advice for treatment. People at an increased risk of developing acute cholecystitis include overweight individuals. Extra weight can lead to gallstones, which can cause this condition. Women, they are more likely to develop gallstones due to hormonal factors. Pregnant women, hormonal changes during pregnancy can increase the risk of gallstones. older adults. The risk goes up as people get older. People with rapid weight loss, losing weight too quickly can lead to gallstones. Those with a high fat diet, eating a lot of fatty or greasy food can increase the chances of gallstones. People with certain conditions like diabetes or liver disease, can raise the risk. Being aware of these factors can help with prevention and early detection. Now you need to watch my video on asbestosis or have a look at tracheal stenosis.